Have you ever opened a hospital bill and thought, what even is this? Why am I being charged for something I didn't even agree to? Yeah, me too. Or maybe you spent 45 minutes on hold with your insurance company, only to be told to call billing and then billing sends you right back. Yeah, that's not just annoying, that's a symptom of a broken system. And that's why I started this playlist. Hey everyone, I'm Casey, and this is Analyze with Casey. I'm a healthcare data nerd, a mom of four. I'm just someone who spent a lot of time trying to make sense of systems that are supposed to help people, but often don't. This channel is for people like us, people who want real explanations, not buzzwords. If you're just joining now, this is the last episode in a series where I've been breaking down the basics of crypto, blockchain, and AI, all through a healthcare lens. If that sounds like your kind of content, go ahead and hit the subscribe button. I make videos like this all the time. Over the last few episodes, we started with one basic question. What even is crypto? We looked at it like digital money, not controlled by banks or the government. Then we talked about how blockchain's like a digital notebook. It can't be erased. Every entry is time-stamped and visible to everyone involved. We looked at smart contracts, which are like tiny pieces of code that say, if this happens, then do this. And that could be huge in healthcare, from pre-authorizations, consent, even automating billing. We talked about privacy, who owns the data, who should own the data, and how we have to be careful with tech that moves faster than regulation. We looked at both sides, the potential and the pitfalls. So now let's talk about something you may have heard tossed around. AI agents. I don't love the term agent, honestly. It sounds like a sci-fi movie. But what it really means is a smart helper. This is you. You've got patience, paperwork, a million tasks. This is your helper. It watches what you do, learns your patterns, and takes actions based on that. Maybe it notices that every time your new patient books an appointment, you always send the same form. It says, cool, I got it. And it starts doing that for you. Maybe it hears you say, patient came in with a headache, order an MRI, and it suggests a note for you to review. That's an AI agent. It reminds, it records, it acts. And it's already being used in EHR systems, scheduling software, and even claims processing. If you'd love to get some of your time back and cut out some of the repetitive stuff, drop a comment and tell me what you want your AI helper to do for you. Now let's get into blockchain again, but simpler this time. Imagine a shared notebook that everyone's involved in. Patients, doctor, insurance company, pharmacist. You can write in it. Nobody can erase what you wrote. Every entry has a time and date. That's blockchain. It's not just about money. It's about trust. It's about knowing the record is real, untouched, and traceable. In healthcare, that can mean less fraud, fewer billing disputes, and records that can't just disappear. Let's say you're not a hospital. You're just a small practice. 3 people, you see 20 patients a week. You don't have a tech team. You just want things to work. Here's what this might look like. Your AI helper sends out a form before the patient arrives. It drafts your notes based on voice input. Blockchain logs every billing event. So when insurance questions it, you've got proof. You don't have to understand how the tech works. You just need to know that the tools are out there and that tools like this are becoming more affordable for smaller clinics. Let me know in the comments, would you try a tool like this if it saved you 5 hours a week? So what's coming next? We'll start to see tools that do some more of the background work without you needing to babysit them. Health records that don't just get lost. Patients will be able to click a button and send their entire healthcare record to a new provider without calling fax numbers. Less time chasing papers, more time actually caring for patients. This is the kind of tech that I want to see. Not flashy, not scary, just helpful, quiet, trustworthy, human-centered. If this video helped you think about crypto in a different way, hit like, drop a comment, and definitely subscribe if you haven't yet. I've got more topics coming soon. Next, we're going to be jumping into radiology and AI. Thanks for watching, and I'll see you in the next one.